Thank you. Good. Good afternoon. Everybody can still see everything, right? You can see the PowerPoint? Okay, perfect. Good afternoon again, everyone. My name is Rochelle Chapman. I'm the Community Engagement Coordinator here at Cures. And so thank you for joining us today for our environmental health chat entitled Tools for Navigating Your Health in Our Digital Environment, Pathways to a Healthier Detroit. You see that nice picture there of a few of us on the front. Let me go to the next slide. Okay. So this event is sponsored by CURES, the Center for Urban Responses to Environmental Stressors, and the Institute of Gerontology here at Wayne State University. Just to give you a little background, CURES is funded by the National Institute of Environmental Health Sciences. It's a P30 core center, and it's housed in Wayne State University Division of Research and Innovation. We call it DORI. We love acronyms here at Wayne State. So also in the Institute of Environmental Health Sciences, led by Dr. Melissa Runge Morris, who is either on the call or will be joining us shortly. So we have a strong commitment here at CURES to serving, informing, and learning from our local community stakeholders and fostering effective, meaningful communications between researchers and the public. Some of our aims that we have is to foster mutually beneficial interactions and co-learning experiences for environmental health research and residents, to serve as a resource for environmental health information, as well as promote environmental health science awareness and advance the science of community engagement research. We usually typically host two of these events per year, environmental health chats, but throughout the year we have 20 smaller events that we call spin-off events, where we bring it to your doorstep, bring it to your church, your community event, and we talk about environmental health education. So today's event will showcase strategies to overcome technology barriers to research participation and provide resources for making these research more accessible. So it doesn't matter where you are on the spectrum, if you're super tech savvy or not, we have something here for you today. Included in this presentation, you'll have highlights about our age-friendly toolkit that Carrie Michaela spent a lot of time, hard work on it. The modules that were created, and also building your capacity information. You are going to get some great presenters. These are my colleagues and community collaborators. Today, you will hear from Dr. Carrie Leach. She is a research assistant professor in the Institute of Gerontology and also the community engagement co-leader here at Cures, and we work together on a daily basis for sure. You will hear from Dale Stubblefield. She is Detroit resident, community engagement specialist for Hope Village Revitalization, and she's a Cures CAB member who we love to collaborate with a lot. And then finally, my other colleague, Michaela Harrison, who is a Master's of Public Health candidate and research assistant at Carmano's Cancer Institute. And so I'm going to turn it over now to Dr. Carrie Leach. It's in your hands.
Thank you, Rochelle. I'm going to share my screen. So thanks everybody for being here, especially some of the people that played a key role in this project. And there's too many to list. They are on the last slide. We're happy to share those slides. And so you'll see all of those names, including Dr. Faith Hopp, who is on the call here. So I just want to set the stage for this talk before myself, Del, and Michaela tell us about our work. Uh-oh. That's not working. Stop. Share this slide. Let's try that again. How's this look? Good. Rochelle's giving me the thumbs up. Okay, great. So I just want to set the stage for why we're talking about this and why it matters. My colleague Nick Schrock and I published a paper in a law journal on the exacerbating role of being digitally disconnected, specifically during a pandemic. And that was a great experience. And Nick mentored me through that process so I could talk about and the policies and how there's older adults become excluded in Detroit. But also, you can see that there are disparities. You can see Oakland County in that line and the average life expectancy there. And then the blue shows Detroit, right? And so being able to connect to resources, including health resources, is a path that we see for helping impact health outcomes, and that's really important to us. And on the right side there, you'll see that that is the Robert Wood Johnson Foundation. Wayne County, we have of 83 counties in Michigan, the poorest health outcomes and health factors that negatively impact us. I'm at the Institute of Gerontology, so all my work really focuses on, and I'm most passionate about connecting with older adults. And specifically in all of my roles, they're situated in Detroit, including at the Center for Urban Responses to Environmental Stressors. And so being able to even get environmental health information in the hands of people that need it, not just older adults, but across the lifespan, is something that we really care about. And we see helping people to digitally get plugged in is one path for being able to do that. And so I just also want to provide a little context for how we got here today and why we've taken this path. In the beginning of the pandemic, Rochelle and I realized we couldn't do our job very well because everyone got socially isolated. We couldn't connect with people on average. Through the community engagement core, we interface with about 500 individuals in a year face to face. We can no longer do that. And in trumpeting that message, we received funding to distribute 1,700 computers, which is great. And Dell helped with that process. You'll see Rochelle and I actually unpacking pallets of computers and delivering them throughout the city. And Dell's in that bottom left-hand corner at the Focus Hope area where we were delivering computers. Wonderful, very well received. However, people said, thank you for the computer. I don't actually know how to use this. The instructions are a size 5 font. I don't actually have the glossary of terms so I can even interpret this. And so we heard very quickly that we needed more. What we started to do was look for resources, for education, information for older adults, and did some more investigating, including talking about these issues that we were hearing from across the city, and went to the Connect 313 symposium, talked about the barriers to using technology, and then again published that paper in the Seattle Journal of Technology, Environmental Innovation Law. And then I was able to secure some funding from the Patient-Centered Outcomes Research Institute. That project is called Bridging the Divide, Fostering Partnerships for Urban African American Aging Research. And there were two specific goals of that project that myself and the team worked on. And one that was creating tools for older adults to be able to use computers. And this isn't limited to older adults, although it's developed with and for people 65 and older, but it really is a 101. Here's the basics of staying safe online, how to connect to Wi-Fi, a glossary of terms, all of the things somebody would need to know to even step into and use technology. And then the second thing was to build the capacity of people to become engaged in research. And so I'll talk a little bit about that later. And that is we have a research readiness curriculum so that people can learn the basics of research and why they might want to get involved. And again, Dell, Michaela, and Rochelle were a big part of all of those activities that leads us here today. And so next, I will hand it over to Michaela. Do you want me to stop sharing so you can share, Michaela?
Yes.
Great.
Okay. So good afternoon, everyone. My name is Michaela Harrison, and this is going to be my presentation on exploring older Detroiters' experiences with technology around the methods and findings. So just a little bit of background about myself. I'm a research assistant at the Carmenos Cancer Institute, Office of Community Outreach and Engagement. I was also the co-project leader and facilitator for our PCORI Bridging the Divide grant at the Institute of Gerontology. I am also a Master's of Public Health candidate at Michigan State University. So where we began. So originally, this is our original toolkit around the Amazon Fire tablet that we were supposed to adapt from Johns Hopkins University. So we were supposed to adapt this guide into a Google Chromebook version. But after taking this guide to our Oakland County Cancer Action Council, which is made up of cancer survivors, advocates, and caregivers who come together to identify their cancer concerns in their community, and our Aging Research Council made up of community collaborators and scholars, they were able to review this guide. And of course, based on this font size, like Carrie said, we have a lot of like little font size, the yellow highlighting and red text, which made it the color contrast hard for older adults' eyes. We decided that we were going to move forward and create a new guide rather than adapting this guide. So just the methods. So we conducted a literature review for the existing resources. We were also able to have that community input from 16 meetings from 2022 to 2024 from our older adults, our aging scholars, and our community collaborators. Again, that included our Aging Research Council and our Oakland County Cancer Action Council. So after that, we were able to pilot and refine our age-friendly technology toolkit with 22 older adults from the Healthier Black Elder Center and community partner sites like Oakman Manor and Friends of Parkside. Also, after that, we were able to collect data via Zoom recordings and audio recordings with some note taking and analyze those recordings and notes and present that to some advisors for our feedback and that updated toolkit. So here on the right, you see a picture of me and a few of my colleagues, of course, Carrie. Here, we were at our Oakland County Cancer Action Council meeting in September of 2024, reviewing that original Johns Hopkins friendly toolkit, which we could see now it has turned into the age-friendly technology toolkit. So next, we're going to go into just a few results after piloting that toolkit. So some of our results included, so a lot of technology related anxiety and fear. So we had a lot of adults who just were concerned about even using technology, opening up a computer. Of course, there's a lot of unfamiliar computer terminology. So that's why we made our glossary of terms to help with that. We had a lot of seniors too who had a lot of password management difficulties. Of course, they had some concerns about safety and vulnerability being online, which we, of course, address in our computer concerns, which Carrie will talk about a little later. We had a lack of age-friendly instructional resources. So again, going back to those font sizes, those color contrasts with certain guides that are supposed to be for older adults, but at the end of the day, they're still kind of not hitting the head on the nail and helping older adults with that technology and those instruction manuals. So after we were also concerned about that Wi-Fi connectivity. So of course you'll see in our age-friendly technology toolkit, we teach seniors how to connect to Wi-Fi as like a first-time user or anything while using your Google Chromebook and those access barriers. So on the right, we have just a graph just telling about our older adult involvement in adapting our age-friendly technology toolkit. So these just show a few of our members, of course, who are from the Oakland County Cancer Action Council, our Aging Research Council, and our pilot session participants, which of course we had the most people who were able to interact with the guide, test the guide out, and give us back that feedback around what needed to be changed and how to better equip older adults using the guide. So this is kind of a little bit, or I would say like a sneak peek of what we ended up with. So this is our age-friendly design. So on the left, you see the original guide, and on the right, you see what we have created. So we were able to go and add those pictures for the keys, the functions, and some descriptions just to tell seniors what this key means, how are you going to use it, also making sure that we're following that larger font size, the less color, the more contrast, that reading ease, and again, adding those glossary of terms and descriptions to tell seniors how to use the computer or how to use these functions on the computer, including like the touchpad, which you see on the right. We made sure that we added pictures so seniors can follow along when we were piloting the guide to how to use the computer. And now I'm going to hand it over to Dell.
Good afternoon. My name is Dell Stubblefield. I am a lifelong resident of the city of Detroit, a community engagement specialist for Hope Village Revitalization, a community-based project, a community-based nonprofit. I'm also a Cures Community Advisory Board member and a senior advocate for better health and well-being. My journey for the last 10 years has been challenging, interesting, and fulfilling. When I started this journey with Cures, the Center for Urban Responses to Environmental Stressors, I didn't know where it would take me or what I would encounter. There were times I wanted to stop my involvement because I felt that I didn't understand the language used by many of the presenters at the meetings. Fortunately, when I had the courage to voice that lack of understanding and feeling that I didn't belong in the room, I found gradually adjustments were being made and I got a better understanding. And along with the encouragement of Carrie and Deborah Beard, I decided to stay in the group. And today I am so absolutely grateful that I did, not only for myself, but also for the many seniors that I'm involved with. And being a part of Cures has given me the opportunity to practice and participate in a variety of projects, such as advocacy training in Hope Village, requesting and receiving masks for the residents of the village of Oakman Manor during COVID, and for the residents to receive valuable information on coping with stress. I have also been able, through my many involvements, to not only gather information and resources for myself, but also become more active in sharing with seniors and encouraging many of them to take a step into an unknown territory for learning, growth, and connections. I also can recall that going back to the beginning of this journey, how hesitant I was to stay involved, the fears I had about not being in the right space, and that really made it possible for me to be more relatable to many of the seniors I encountered. When I started to share my fears and anxiety, I found a level of comfort in my ability to make a connection and be able to say, I understand how you feel. I've been there. Hang in there. It's going to be okay. And it's a chance to learn and have a new life experience. It also gave me the courage to try and explore other ways of involvement and openly encourage and share. I have found on this journey how reluctant I had been in the past to participate and in certain surveys or requests that I had received. I had also received information about regarding research, and I was hesitant to take part in that. Now, while it's always necessary to know your sources and to be careful about your input, I found that trusted sources through university and community partnerships that have given me not just opportunities to participate, but a better understanding of why not only I should participate in research, but also to encourage others to become engaged and do the same. Whether it's research regarding aging health issues or technology, there can be a value added by getting a better understanding of the reasons for the various research. I've also found through participating in research opportunities, my life is richer by the process of involvement, learning, and connecting, which can add to a healthy day-to-day living and longevity. I believe seniors can not only add years, but can also make their lives better through research involvement. They can become more engaged for themselves and help other seniors to not just live long, but to live well through the participation in research opportunities and getting other seniors involved also, and being able to share with their family and friends how they are involved, the process of getting involved, and how it is really helping them. Thank you. I'll turn it back to Michaela.
Thanks, Dal. I struggle to follow her whenever we co-present, and you can see why. Let me share my screen. Thank you so much, Dal. I love to hear your story, and it encourages, I think, wherever we go and whenever we present together, it encourages other people to learn about the benefits of doing so, which is why we're here to talk about tools for connecting people with research. Okay. I just need somebody to nod to make sure you can see my screen and just the slide and not the presenter view. I'm getting no nods. Rochelle, can you see that?
Yes, we can see it.
Thank you, Melissa. Okay, my name is Carrie Leach. I'm a research assistant professor at Institute of Gerontology, and I co-lead the Community Engagement Core at the CURES, Center for Urban Responses to Environmental Stressors, where I work with Rochelle and Dal, and also lead community engagement for the Collaborative for the Promotion of Access to Technology and Health. We're going to advance this slide.
Your slide view is a bit on the small side, just saying.
Oh, so you can see the slide view and not the...
You can see
Center view, yeah.
it's kind of small. It's not presentation size.
Okay, I'm so glad you
About
told me.
technology. Jeez.
Carrie,
Thank
do
you.
you want me to try to just share my screen again, or?
Oh, let me try one more time. I'm sorry. Thank you, Melissa.
And I knew it was going to be maybe okay to see your name and stuff, but after that, it might be dicey to see it.
Better?
No, it's the same.
No.
Oh, I'm sharing the wrong screen. We are here to address technology issues. Okay, let's try one more time.
That is better.
That's it.
Yes.
Good.
Okay, because we, just to everybody, bear with me here, because we break this big a presentation up into 3 smaller videos, I do have to start over to introduce myself. So everybody bear with us as we all struggle with technology and move forward. So thank you, Melissa. And I'm gonna take it from the top. I'm Carrie Leach. Thanks for being with us here today, everybody. My roles, just so you know a little bit about me, I'm a research assistant professor at the Institute of Gerontology and a community engagement co-leader at the CURES, the Center for Urban Responses to Environmental Stressors. And this presentation is done with Dell, Rochelle, and Michaela, who have been involved with this project since the start. And I'm also a lead community engagement for the Collaborative for the Promotion of Access to Technology and Health. And so I just wanted to provide a little bit of background about why we're here today, talking about the digital divide. First of all, we started distributing computers in 2021, and what we learned about that, oh no, I'm going forward. What we learned about that during that process is that people wanted more information about how to use technology so they could participate in not only research, but also healthcare was going online. A lot of people were experiencing telehealth that they couldn't participate in, or during the pandemic wanted to attend worship services, but didn't know how to do that virtually. So we started looking into those issues when we were doing a policy analysis and co-published a paper with my colleague, Professor Nick Schrock, who is at University of Detroit Mercy Law, and found not only we realized that Detroit had one of the lowest internet connectivity rates in the nation, but in doing some more research, we learned not only people not have computers, but there was a lot of barriers to be able to connect to technology besides just the cost of Wi-Fi, the actual devices themselves. We learned a lot about what the barriers were in that process. And so in moving forward through this process, Rochelle and I went through the process of trying to figure out how can we find funding to build the capacity of older adults to use technology so we could engage them in virtual research, including Dell, who's an older adult herself, and that we engage in our virtual community advisory board meetings. So it became very important for us. And so we secured funding through the Patient-Centered Outcomes Research Institute, and that project is Bridging the Divide, Fostering Partnerships for Urban African American Aging Research. And I just want to first and foremost thank the project collaborators that were on this project. You'll see Deborah Beard here, Del Stubblefield, Winona Bynum, and Sandra Turner Handy have been with the Cures for about at least 10 years since I've been a part of Cures. Oh, now it's 11, since 2014. And also I added a new partner who we met when we were at the Connect 313 Symposium, where Rochelle, myself, Del, and Nick presented about our concerns about the digital divide in Detroit. So we added Zachary, he's at Friends of Parkside in Detroit, and just allowed us to increase our reach. And these 5 individuals in particular are very concerned about the digital divide and older adults as well. And this is everybody else we worked with. So this is, as you know, research is a team sport and can't be done alone. And so while you heard in Michaela's presentation earlier about how we went about getting this age-friendly technology toolkit created, I'm going to talk about the outcomes of that and what we actually have to offer. And we are having this conversation today with researchers after we've already presented to older adults earlier this year in March. We had about 75 older adults that we spoke with that attended that event. We received 17 requests for this information to be shared in through spinoffs in our mobile education. And that is Rochelle's charge. That's what she does. But we wanted to have this in video format and because that was an in-person meeting. And so we're here today to be able to present the outcomes of that project so that Rochelle can go and share the information across the city, because we know when we hold events, we're able to reach 3 times as many people in our community engagement through Cures when we are doing in-person events to people at a location of their choice. So what we have here, and we hope that researchers will use, is an age-friendly technology toolkit that is co-created with older adults for older adults, including Dell that you heard from earlier and talked about her experience. So this goes through computer concerns and connection. And we have created a fact sheet based on what we heard, because there's a lot of fear and anxiety around technology. And so we really wanted to make sure that this guide reflects the need of the older adults that we created this with. You'll see here, people also wanted information about where can I get a low or no cost internet plan? Where can I get an affordable device in the city? And so this is very Detroit centric. This came out of our work with our Aging Research Council, all the older adults and all of the researchers that we worked with. And so we have actual resources that are very localized for Detroiters so that they can connect to the resources that will help them get plugged in. What we also heard is that people were worried about staying safe online. If I use a computer and I go to McDonald's and they might have a Wi-Fi, how do I know that people aren't going to get on my computer if I'm there? And so what we did was create a few, the very first pages that you open in this age-friendly technology toolkit is one, the resources for getting connected, but also how you can stay safe, access Wi-Fi in your neighborhood by calling 211. And then some people said, I don't really understand why I would use a computer. I made it to age 80. I haven't used one. And why would I use one now? We also found that in the literature, a lot of people didn't see the benefit. So we just included a few tips there because it reflects what we heard from the people that we created this with. And then the other tool that came out of this project that I really want to encourage other researchers to use is a research readiness curriculum. So this helps to build not just older adults' capacity for engaging in research, but understanding at a 101 level what research is, what it does, who's doing it, how it's done. And I just want to talk through a few of these modules. One, it's just a basic 101 introduction to research and evaluation. We talk about community academic partnerships and research. We also have some great presentations from our Cures Community Advisory Board members that talk have videos as part of this curriculum. This is open access. This is all, once you click on any of the modules here, you'll be able to go right to all of the videos that we've created, all of the materials that we've created to prepare people for getting ready to engage in research. We have a module on research ethics and institutional review boards, literature review, why we do that, why it matters, and evaluating information sources, which is very important. Module 5, developing research questions, talking about research design, including in Module 7, qualitative and quantitative methods and what that is. And then we talk about grant writing, review, and health policy. And then we have the acknowledgements, of course, including other videos and supplemental material that I think is really useful for preparing people that are not familiar with research and why they might want to get involved. Again, I just wanted to illustrate for everybody, if you click on here, you'll see it will take you directly to the drive and you're able to access all of these videos and materials. And you can see the time. This won't take a very long time, but we delivered this in about an hour's long session and just talked through all the videos and created space for understanding co-learning and dialogue and also what was missing. And so just wanted to share that this is very easy to access for anyone that might want to take it themselves in a self-guided way, researchers that might want to use this and present it to people that they're starting to work with, or for any other purpose. This is the second module on community academic partnerships. Again, we have some great resources and videos from our community advisory board members. And again, I just want to share this. This is where all of this information is stored and accessed. We developed a web page here, and it has not only the whole entire toolkit, but it's also broken out by individual fact sheets, so you don't have to print the entire thing. And then also the curriculum is also housed on this web page too for ease. And finally, I just wanted to talk about my own future directions. I'm a pilot scholar for the Michigan Center for Urban African American Aging Research. This is a map that Alex Lafleur from the Cure Center created for me as I tried to visualize the way that I'm reaching people. And I'm actually through about 74 interviews across the city, and you can see the reach. Studying this in greater depth, more than a divide, exploring the challenges older adults experience, engaging with health services and information in a digitally disconnected urban environment. And again, this was our photo from March that I love to share from all of the people, some of the people we work with, not everybody, but a great event and a luncheon there we had for that Cures and the Healthier Black Elder Center put on. We were able to distribute print copies there. My project collaborators, and that is it. I'm going to stop sharing. And we always want to make sure whenever we're having an event that we're making space for Q&A and people to ask questions, whether that's Dell, Rochelle, Michaela, myself, and leave enough space so that we're building the understanding, not just from what we think is important to deliver, but that anybody that might have question has time to answer that. So thank you. And the crowd goes crazy. Thanks, Graham.
So if you have any questions, you can either raise your hand or unmute yourself at this time about the process, any questions for the team?
Also, I want to say really quickly, thanks to Abrar, she's also on the call. She had a lot of work in this project. So thanks, Abrar, for joining.
Hi, Abrar. If you want to turn your camera off on no pressure, but she also works very closely with Rochelle and I at Cures. She's doing a lot of our video management and helping with our YouTube channel, which has a lot of content. And what we do is we take these videos and post them there so that Rochelle can go distribute them throughout the city. And Abrar's doing a lot of wonderful work on our team, our community engagement team, not only for the project we just talked about, but also for all of our work going forward. So thank you for being here, Abrar, and great to see you.
And I see Melissa's hand up. Oh, you're still on mute. There you go.
Yeah, sorry. Yeah, thank you. This is a great presentation and really admire your commitment to this important issue because you know, with the advances of technology that we're seeing, it's just really a real major force in our society. I don't think any age group of any kind can hide from it. I think we're going to be faced with not less of this, but more of this. And I really liked your presentation, Dell, when you talked about um, the what amounts to having confidence to learn something new and to not be afraid to ask a question. And that is a common thread for anybody, whether you're in the lay community or whether you're older or not older, or whether you are a faculty member from another discipline or department, and then you're afraid to raise your hand because you might look stupid. You know, I don't know what that term means, but yet that happens to all of us. And I think the larger issue is helping people develop the confidence that they can learn new things like this and continue to grow, no matter what their age is. I think that's something our society dropped the ball on, and I really think this type of work's important. Next thing, will it be AI, right? Isn't that coming into everything? And just try calling customer service, you guys. Good luck with that. You'll get into one of those menus. Whoa, I don't know. And the more we can, you know, see this as a group challenge for everyone and get our confidence going, then the better we'll be able to tackle these things that are just, they're not going away. They're going to be just part and parcel of our society.
Yeah, Melissa, I just want to follow up on what you said. It's so important. This automation, what I'm hearing in the interviews and my research on older adults in general is like, I stopped renewing my driver's license because I'm so frustrated when I called Secretary of State to try and, get through any process, and I just couldn't do it. And now I no longer drive. And what does that mean, right, for health outcomes? It means you're no longer getting out. And these micro interactions, even if you're going to the grocery store and seeing a flyer for opportunities, those are really a huge detriment to a person's health and well-being because they're no longer out in their community and engaging in even micro ways. And so I just, yeah, this automation and over-reliance on technology, especially as you try to access services of support when you're 85 years old, is a really big challenge for people. And like you said, it's becoming even more so and continuing. And Del, I wonder if you might talk a little bit more about, not to call you out, but Del has a lot going on. She's been not only, and her daughter's here, which I'm so glad to see, Terry, who's on here, Terry Stubblefield. But I wonder if you might talk a little bit about what you're doing now. I know that you said that you're thinking about going back to school, and you always talk about how your involvement with research has really been the impetus for your next era. We were just talking before everybody got on the call. Del talking about I'm in my next era, and she is, I don't want to, that's Dell's decision to say her age and how comfortable she is, but she does talk about it like she's in a whole new era of her life based on her involvement with research. And I'd love to hear that story because I think it's so encouraging, not even for us as a research community where we think people don't want to be engaged with research, but she's always encouraging people to get in research because you don't know what those benefits might be. And I just want to plug her for one more minute before I ask. We went to put on a workshop for, I think it was nearly 20 researchers from around the United States. And I gave a presentation with Dell and two of our other Cures Community Advisory Board members, including Sandra Turner Handy, who is our co-chair, and then Deborah Stewart Anderson, which from Zero Waste Detroit. And I said to Dell before we walked in that room, these are researchers from across the nation. And they are wanting to learn and be advised about engaging older adults in their work. You might want to offer yourself as a consultant. And she did that, and I think she was surprised. But people approached her and said, I really could use you as a consultant so I can understand how to go about integrating community voice in my project. And I think we were surprised to see there was a lot of attention and interest in that as a possible path. And now, anyway, so I'm going to stop there, Del. Any notes you want to add to me just tooting your horn?
Well, as I mentioned, that at first I was kind of reluctant to get on this journey. but I'm really glad I did it. It has led to so many things, not just assisting other seniors, broaden their knowledge, expand their lives, and really create something wonderful. It's also opened up something for me inside of wanting more. And I'm at the point now where on my job as a community engagement specialist, I feel stuck. I feel like in 6 years I've had this position, I haven't grown the way that I would like to. And I started getting really frustrated. So after Carrie mentioned about the avenue of a consultant, I I didn't know what I would do with that. I was surprised that she said that, but things have been opening up for me from that, like my desire to return to school. I have about 3.5 years of college in, but I didn't complete and get a degree. So I'm sincerely considering at the end of this year leaving my job, returning to school to complete that. And that courage kind of comes from the involvement with cures and with research. It has helped me really grow as a person and move past a lot of the fears that have stopped me in my life. And I just recently found out about an entrepreneur academy that's going to be held at DABO, Detroit Association of Black Organizations, and it's free. It's a 4-part series. And so I started thinking, well, if Carrie is putting me on this path for a consultant, I better go out there and, just get all the help I can get, all the knowledge I can get, and all the involvement. So I'm going to participate in that 4-part Entrepreneur Academy. I'm going to work on designing a business card. I'm going to talk with my daughter, who can always give me, uh, based on her work experience, she gives me a lot of professional guidance and insight. And through this whole process, I feel like I'm leaving a valuable legacy for my grandchildren. And through the way I'm living my life, they can see that as they age, it it shouldn't stop them from getting involved in different things, in returning to school and broadening their horizons. So I think that's it, unless anyone has a particular question or comment.
I wanted to say something.
Please.
Hi, Mom.
Hi, Terry.
So proud of you. I just want to let everybody know our family is so proud of our mom. My mom. She's my mom. But I also want to say, it's hard to keep up with her. We got to our game all the time. Trying to keep up with her, but you go, Mom. I'm really, really happy for you and so proud of you.
Thank you so
This
much.
information was very informative today from all who presented. I think it is a worthy cause, and I look forward to hearing more about it. Thank you.
Thank you, Terry.
Okay.
Oh, I see someone is saying if I'm age 55 and over, I'm 82, and I claim every year of it, every day of it, and I am not 82 years young. I am 82. I am age 82. And based on my life experience, I'm grateful to be here today, and I claim every year.
This is Faith. One quick comment. Dell, your daughter is also amazing. You are the superstar family. I work with your daughter in the School of Social Work with Terry. And
Oh.
and I was before I started sharing this before you mentioned already being in an entrepreneurial course, but this is another program that St. Pat's is offering in Midtown, and it's free also. So just to let other people know too that this is going on, we're trying to get the word out. So
Okay,
glad you're
thank
involved
you.
with something. Yeah.
Thank you.
Thank you, Faith. Any other questions or comments? Silent pause, awkward silence. Okay.
I'm so glad to, I did receive a confidential message from another person that would like to be involved in our research. So always good news, even if you don't want to say it out loud or raise your hand and you want to privately message me. I'll also put my email in the chat in case you just want to email me directly and we can talk, and I'm happy to do that. So let me do that right now. Also, okay, there we go. In case you don't feel comfortable getting on camera, no pressure. We know not everybody wants to do that. But thank you for the messages. Okay, well, we have this. And while we have you, thanks for putting that in there, Rochelle, the links to the technology and also to our community engagement core. And just so you know, we have a few evaluations. One, not just so that we can report to our funders why we do this work, and then to get the feedback to improve how we deliver this information. But another one of those links is how we really get the word out beyond having this meeting that we're having today. We know that people have a lot of challenges. They have jobs, people have children to take care of, and that when we deliver an event, it's not always the perfect time for everybody. So again, what we do is give you an evaluation. It will say, would you like this information shared in your small group? And again, like at the March event, we had 75 people there, but then 17 people said, yes, please come to my small group. My neighborhood block club. I've talked to grandparents groups where they want to learn about this. And so we continue through Snowball to be able to get information out beyond just what we're doing today. We also know there's limitations. Talking about technology through technology is not a great approach, right? And so even if you know somebody you think might benefit, please fill out that evaluation. Rochelle gets your email or your phone number. She can follow up with you, and that she can come and present this information to your small group. We create videos out of this, put it on our YouTube, and Rochelle goes and plays those videos and has the conversation with people so that we can continue to build people's access to resources, technology, and also the environmental health information that is the driver of why we're here today. We want people to be able to make good decisions, and that also is for individuals, neighborhoods, all the way up to the policy analysis level. So we really want to be able to connect with people, and we know this isn't the only way we can do it in having these environmental health chats, but it goes beyond that. So we would appreciate you clicking on that link, filling out that evaluation, and if you'd like us to come and speak with you in some other format, or just Dell and leave Rochelle and Michaela and myself behind, that's an option too. I really appreciate everybody taking the time, and I'm going to stop talking now and give the microphone to our leader, Rochelle Chapman.
Thank you, Carrie. Yeah, that's it. Thank you, everyone, for your time. We'll make sure that you get an email as well with both of those links in there. And any feedback that you give us will be very helpful. Just want to shout out Dr. Carrie Leach, Dale Stubblefield, and Michaela Harrison for a great job. Thank you all so much.
Thanks, Rochelle. Rochelle, can I stay on here a minute in case the person that messaged me wants to get on camera while everybody starts to leave?
Absolutely.
Okay, great. I don't have to be anywhere till the hour. So thank you.
Thank you, everyone.
Thanks.